Welcome to The Explainer. Today, we're diving straight into a really fascinating intersection of two totally different worlds. We're looking at how the fight against pneumonia is being completely revolutionized. And it's happening by combining cutting-edge, deep learning algorithms on one side with some remarkably simple, grassroots public health policy on the other. It's honestly an amazing story of how the absolute highest tiers of computer science are aligning with basic, on-the-ground community care to tackle one of our oldest foes.
Just to wrap our heads around the stakes here, we have to recognize the sheer scale of the problem. Pneumonia isn't just some bad cough. It accounts for about 18% of all infectious diseases globally, and tragically, it claims over 1 million children's lives every single year. The hardest part to hear? It is consistently the #1 killer worldwide of children under 5. So yeah, these are staggering numbers, and they demand absolutely our best problem-solving capabilities.
Which brings us to the big question. How do we actually defeat a global threat of this massive scale, especially when you think about how this disease operates across wildly different economic landscapes? I mean, we need solutions that work just as well in a state-of-the-art hospital in London as they do in a remote rural village in Pakistan or sub-Saharan Africa, where resources are frankly incredibly scarce. Okay, so let's start with the high-tech fix. For decades, getting a certain pneumonia diagnosis meant a doctor had to painstakingly visually interpret an entire chest X-ray. It takes time, requires highly specialized training, and, let's face it, humans get tired. But now, that traditional method is being challenged by deep learning models. Researchers, like the team behind a major 2019 study out of Furat University, are using convolutional neural networks, or CNNs. Instead of relying on a fatigued human eye, these networks automatically extract millions of tiny visual features from lung X-rays literally in a fraction of a second.
And the results of this tech? Absolutely mind-blowing. By feeding those extracted features into classifiers, specifically support vector machines, the researchers hit a 95.8% diagnostic success rate. Just think about that for a second. It's definitive proof that AI can spot these fatal diseases way faster and way more accurately than our current biomedical methods. We're talking about early diagnosis at scale, which is always the first most massive hurdle in saving lives.
But, diagnosing a child with a super smart algorithm is really only half the battle. You still have to cure them. And that is exactly where a monumental shift in global health policy steps in. A seemingly low-tech, common-sense policy pivot from the World Health Organization is actively saving lives on the ground, completely changing how the global health community actually treats childhood pneumonia. The WHO did something brilliantly simple. They radically streamlined their strategy. They took a pretty confusing 3-tiered diagnostic classification and collapsed it down into a straightforward 2-tier system. Before, health workers had to constantly differentiate between fast breathing, chest indrawing, and general danger signs. Now, it's boiled right down to just 2 categories: pneumonia and severe pneumonia. And this isn't just some administrative paperwork update. This is a massive operational upgrade. It makes training health workers so much easier, and it makes triaging patients infinitely faster.
And this leads to the most practical, real-world change on the ground. Under the old rules, a child presenting with chest indrawing, which is when the lower chest wall visibly pulls in when they take a breath, well, they were automatically classified as a severe case. That meant an immediate mandatory hospital trip for invasive injections. But the revised rules safely reclassify this for home care. Just imagine the emotional relief there. No more automatic hospitalization. No more terrifying, incredibly expensive journeys to a distant clinic for a scared, stressed family.
Now, the reason they can actually make that shift is backed by hard science. Massive multi-country clinical trials like the APIS and no-shot studies prove something amazing. A simple oral pill is just as effective as painful, resource-heavy penicillin injections. For a long time, we really thought you absolutely needed a needle to fight an infection of this level. But the data unequivocally says otherwise. A pill does the job just as well.
So the new protocol is elegantly simple. It calls for a high dose of oral amoxicillin, about 80 to 90 milligrams per kilogram of the child's weight every day. But the real game changer is step 2. You only have to give it twice a day. Why is that such a big deal? Because shifting from an older 3 times a day schedule to just morning and night drastically improves parent compliance. You give a dose when they wake up, a dose before bed, and you're effectively treating the child right in the comfort of their own home.
When you zoom out and look at the actual economics of care, using data from Pakistan as an example, the disparity is just shocking. Treating a severe pneumonia episode in a hospital setup, that can cost up to $235. Even a regular inpatient stay hovers around $71. But when we empower community lady health workers to manage that exact same condition at home with oral antibiotics, the cost literally plummets to a mere $1.46 per case. We're talking about a total paradigm shift in healthcare economics here.
And it's not just about the money, right? Beyond the immense financial relief for both the healthcare system and struggling families, treating kids at home provides crucial, tangible health benefits. It actively shields these vulnerable children from the very real dangers of hospital-acquired infections. Think about it. Hospitals are full of sick people, and a child with a compromised respiratory system is incredibly susceptible. Plus, by ditching the injectables, we completely eliminate the risks of injection-borne diseases and complications from unsterile needles. Now, to make this solution truly scalable across the globe, the WHO strongly advocates using flexible, solid oral dosages instead of standard liquid medicines. You might naturally assume liquid medicine is better for little kids, right? But the reality is actually surprisingly different. Liquids expire much faster, they're heavy, and they cost an absolute fortune to ship globally. And worst of all, they frequently lead to accidental underdosing or overdosing, mainly because those little plastic dosing spoons are notoriously inaccurate. Solid oral dosages fix every single one of those logistical nightmares.
But I know what you're thinking. How you get a 6-month-old baby to swallow a solid pill? The genius answer is dispersible amoxicillin tablets. These are specifically formulated to just dissolve instantly in a little bit of clean water or even breast milk. By using these dispersible tablets, we guarantee an exact, safe, and easily consumable dose for even the tiniest infants. And we get to completely skip the shipping and storage headaches of liquid syrups. It's just an incredibly smart, incredibly effective low-tech innovation.
Ultimately, all of this reveals a pretty profound truth about the future of medicine. What we're looking at here is a powerhouse combination. You have advanced artificial intelligence that can see the invisible with near-perfect accuracy. And it's being paired perfectly with radically accessible, low-tech, low-cost treatments that literally anyone can administer at home. So it leaves us with a really vital question to ponder. If we can beat a massive, historical killer like pneumonia by marrying the absolute highest of high-tech with the simplest of grassroots care, what other global health giants are ready to fall? Thanks for joining me on this explainer, and keep questioning how we can build a healthier world.